Well, good afternoon, everyone. Happy Wednesday. Welcome to today's COVID-19 update briefing. Today, I'm joined by Dr. Michael Lin, infectious disease specialist and hospital epidemiologist at Rush Hospital, who will provide some further insight into the dangers and health consequences of playing youth sports during the COVID-19 pandemic. I'll begin today by touching on that topic myself before we move on to today's regional metrics update and a few other items. We all want our kids to be able to play sports. We all want our kids attending in person at school. And we all wish that this pandemic were over. But unfortunately, until we're able to make that third wish come true, our ability to make progress on the first two is somewhat limited. As schools and school teams have come back together this month, many sports have made adjustments to keep kids safe so that they can play with a lower likelihood of transmitting the disease. Some sports, like youth football, are more difficult and offer a higher likelihood of transmission. Over the summer, we saw outbreaks across Illinois and the world tied to a variety of youth sports leagues. Those continue today, even among the lowest risk youth sports. We have watched professional sports and even some college teams play seemingly without many problems. But remember that these programs are operating with daily testing or in a league-created bubble or with facilities that allow for outsized social distancing and are sanitized every day. And in some cases, all of those precautions have been taken. That's not what's available to the vast majority of young people who play sports in Illinois. We've seen outbreaks here that have infected dozens of players, coaches, and family members, including one just last week in Wayne County, where nearly 100 players have been quarantined, and so far 37 have tested positive. Look, I'm not a scientist, but I do know how to listen to the experts and follow the latest data. I've always promised to do that, and I've always promised to be transparent about that, and I always will do that, no matter the political pressure. Under no circumstances will I put children and their families at risk. To those claiming that putting your child in danger is about personal choice, I say this is a pandemic. This is a terrible and unprecedented moment in our country. Living together in a free society means neighbors protecting each other so that we can all enjoy freedom and safety. This deadly virus should remind us that there are some individual choices that have enormous life-changing impact on others. While parents might choose to send their children out onto the playing field, I can tell you that someone else who becomes ill because of that decision wouldn't call that your personal choice. I want our kids back on the playing field or on the ice as much as anyone, and we'll get there when the doctors say it's safe. Until then, let's focus on keeping our schools and our businesses open and on keeping everyone safe. Let's be kind to one another, too. In a few moments, I'll ask Dr. Lin to speak further on this topic. So on to our regular update. Last week, I said that I was hopeful that Region 7, that's Will and Kankakee counties, might become a testament to a community's ability to turn their ship around. Well, I'm very happy to say my hopefulness hasn't been unwarranted. Yesterday, Region 7 brought its rolling 7-day average below 7.0 for the first time in weeks. And today, that number sits at 6.4%. The first day below our 6.5% benchmark, indicating a reduced severity of community spread. IDPH will continue to watch that positivity over the next few days, and if that trend holds for 3 days, we will remove the resurgence mitigations and return the entire region to phase 4 of the Restore Illinois plan. Masks, distance, hand washing, enforcement, it all works. And Will and Kankakee counties are so far getting the job done, and we're all rooting for them. Over the last 2 weeks, nearly every region in the state has seen a stable or declining positivity rate. That includes Region 4, the Metro East region, which has been sitting above an 8% positivity rate since August 11th. Over these first 2 weeks of September, Region 4's rolling average dropped from 9.6% to 8.9% as of today. Let that downward movement be a testament to the fact that these doctor-recommended mitigations can work if they are followed. And I encourage residents of Metro East to call upon your local law enforcement and local public health officials to work together to help enforce the guidance and encourage masking and distancing so that that region can see even greater progress over the coming days and weeks. I want to turn your attention to other elements of our COVID-19 response, starting with our upcoming election. This morning, I sent a letter to the Illinois State Board of Elections regarding the two trends that we've seen emerge from this pandemic. One, a massive uptick in vote-by-mail requests as people continue to seek ways to reduce day-to-day risks in this pandemic. And two, a shortage of thousands of election judges, a position historically filled by older individuals who now are among the most at risk for COVID-19's worst impacts. To tackle these concerns and others, and to make sure that we conduct a safe, free, and fair election, I'm calling on the board to use $4 million in Help America Vote Act funds to develop an emergency grant program that will further subsidize and incentivize the use of drop boxes, will support local efforts to recruit election judges, and address other challenges confronting some of the county election officials across our state. Never before in our lifetimes have we faced an election amidst a pandemic of this scale. The Board of Elections directors shouldn't wake up the day after Election Day and wish that they had done more to strengthen our democracy and ensure our most fundamental right, the right to vote. I also want to provide an additional update on our state finances in this COVID-induced financial crisis. State and municipal budgets across the nation and here in Illinois are being decimated. And Republicans in Washington have so far decided that sending trillions of dollars to corporations is more important than providing support for public safety, human services, mental health, and senior care, among others. Today, I sent a letter to Illinois' Congressional Delegation outlining the potentially bleak picture for our schools, our firefighters, our law enforcement, our universities, our healthcare system, and all of our middle class, working class, and poor families if the Republicans don't work with the Democrats on behalf of our national economic recovery. In the letter, I reminded them that this isn't a problem unique to Illinois. I said, quote, "It's not a blue state problem or a red state problem. Texas is facing its biggest budget shortfall in history, and Florida's governor likened their budget situation to the red wedding scene in Game of Thrones. Similarly, cities and counties across America are facing massive service cuts that will have immediate effects on residents. As for Illinois, yesterday, as you know, I directed all agencies to prepare to cut operating budgets by 5% this fiscal year and potentially by 10% next year. Without help from Republicans in Washington, that translates directly into potential layoffs and a massive reduction of essential services for families across our state. That will deepen our economic recession and cause pain for all Americans. I ask President Trump and Republicans in Congress to act quickly to keep from deepening this already painful recession. Finally, it is in that same vein, keeping people on their feet and putting us all on the path to a faster recovery, that I will continue to work with leaders in the General Assembly as well as in Congress to advocate for more federal assistance to keep people in their homes. The need here in Illinois and across the nation is tremendous. Over 100,000 Illinois tenants and homeowners applied for our assistance program, but we only have enough funds to support approximately 40,000 of them. And ours is the largest pandemic housing stability program in the nation. It is for that reason that I'll be extending our eviction moratorium for an additional 30 days. Here in Illinois, we will use every legal tool at our disposal to keep people safe and healthy and employed and housed. So thank you, and with that, I'd like to turn it over to our Director of the Department of Public Health, Dr. Ngasia Zike. Doctor.
Thank you, Governor. As the Governor mentioned, we have been seeing cases and outbreaks of COVID-19 associated with sports teams. The science says the more people a person interacts with, the closer their physical interaction, thinking about that 6 feet or not having that 6 feet, the more they share equipment with multiple players, and the longer the period of interaction, the higher risk of COVID-19. While some professional sports have resumed, they have done so with so many protocols in place. Again, as the Governor mentioned, they are being quarantined, they're in their bubbles, they're placed in isolation, sometimes daily testing is occurring. I don't know how many high school teams or grade school teams would have the ability to provide that level of testing, daily testing. The science is the same for sports as it is for restaurants, meetings, nursing homes, you name the situation. The more people you are around, the closer you are to them, and the longer you are around them, the greater the risk of transmitting COVID-19. And this includes colleges and universities. Back to school season is upon us, and you have all seen and heard that in this time of COVID-19, it has brought unique and never before seen challenges. I want to thank the colleges and universities that have taken strong and immediate action after seeing COVID-19 outbreaks on their campuses. In many cases, the outbreaks have been associated with off-campus parties or off-campus gatherings and students going to neighborhood bars, but the outbreaks come back to the campus nonetheless. Whether it's on campus or off, the universities are working diligently to prevent spread. In response to one such outbreak, a university instituted a 2-week quarantine to reduce the spread of COVID-19. As Dr. Fauci and other national experts are advising, isolate and quarantine at your school residence. Isolation plans and care plans have been established, and traveling back home could cause intercommunity spread, inter-county spread, interstate spread, depending on where home is. And the risk of traveling, whether it's by bus or train or plane, gives the additional opportunity for spread. Not to mention the possibility of infecting household contacts who may not be as young or as able to withstand the effects of the infection. I know the TLC and the food won't be the same, but we advise you to stay at school. The state is working to reduce spread on campuses by working with the Illinois Board of Higher Education to place more testing opportunities near campuses. Testing is the first step in identifying and confirming cases. Today, we are reporting 1,941 new cases of COVID-19 for a total of 266,151 cases in the state of Illinois. Most regrettably, there have been 35 additional deaths that are reported for a total of 8,367 lives lost. In the hospitals overnight in Illinois, 1,565 people were reported in-house, Of those, 345 were in the ICU and 143 on ventilators. In the last 24 hours, more than 52,000 lab results have been reported for a total of more than 4.8 million tests since the beginning of this pandemic. Hearing about the number of people who have been infected, people hospitalized, people who have died, of course, this all causes worry, fear, anxiety, stress. This is probably the hardest time for almost everyone in this state and around the world. If you feel overwhelmed by stress and anxiety, please seek mental health services. It's not a sign of weakness, but of strength. It takes strength to ask for help, and right now we could all use some form of assistance in one form or another. I'd be the first to testify to that. Stress and worry will worsen many chronic physical and mental health conditions. So please make sure you're keeping up with both your medical and physical health, mental health and physical health. Keep up with your medical appointments and continue to monitor your health. Another easy way to stay on top of your health is to get a flu shot. There currently is no COVID vaccine, as you're well aware, but there is one for the flu, and now is the time to get it. One of the things we clearly don't want to see is what it looks like to have the co-infection of influenza and COVID-19. Get the flu shot or the nasal spray if you're eligible, and let's try to prevent the flu. Of course, the more you wear your face mask, you decrease your chance of contracting either of those, as well as a host of other respiratory viruses. So to that end, I remind you of the 3 W's: wash your hands, watch your distance, and wear your face covering. And with that, I will repeat comments in Spanish. Como les ha dicho el gobernador, hemos visto casos y brotes de COVID-19 asociados con los campamentos deportivos. La ciencia dice que entre más interacciones con otras personas, entre más contacto físico, entre más se comparte equipo entre jugadores y se pasan más tiempo juntos, más alto el riesgo de COVID-19. Aunque los deportes profesionales han resumido, lo han hecho con muchos protocolos. Estos incluyen poner a los jugadores en cuarentena o aislarlos, administrar pruebas rutinas, a veces a diario, limpieza intensiva, prácticas alteradas y potencialmente cancelación de juegos. No conozco muchas escuelas que tengan la capacidad de proveer pruebas diarias. Esto incluye a los colegios y a las universidades. Quiero agradecer a los colegios y a las universidades que han tomado medidas firmes e inmediatas después de ver brotes en sus campos escolares, fuera y dentro de los campos escolares. Muchas universidades están trabajando con diligencia para prevenir la propagación de este virus. Por ejemplo, una universidad instituyó una cuarentena de 2 semanas para reducir la propagación del COVID-19 en respuesta a un brote. La prueba es el primer paso para identificar y confirmar casos. Hoy reportamos 1,941 casos de COVID-19 para un total de 266,151 casos en Illinois. También ha habido 35 muertes adicionales para un total de 8,367 vidas perdidas. Se informa que 1,565 personas en Illinois pasaron la noche en el hospital con COVID-19. De ellos, 345 pacientes estuvieron en la unidad de cuidados intensivos y 143 pacientes necesitaron ventiladores. En las últimas 24 horas se hicieron más de 52,000 pruebas para un total de más de 4.8 millones de pruebas realizadas. Oír estos informes de las personas infectadas, hospitalizadas y cantidad de muertes puede causar miedo, preocupación y ansiedad. Si usted se siente agobiado o inundado por estrés y ansiedad, busque servicios de salud mental. No es señal de debilidad, sino de fuerza. Se requiere una persona fuerte para pedir ayuda y ahora muchos necesitamos esa ayuda. El estrés y la ansiedad podrían empeorar muchos impedimentos crónicos físicos y mentales, así que por favor, asegúrese de no perder sus citas médicas y no deje de monitorear su salud. Otra forma fácil de ayudar a mantenerse saludable es vacunándose contra la influenza. Actualmente no existe una vacuna para el COVID-19, pero sí hay una para la influenza. Una de las cosas que no quisiéramos ver es que la gente tenga COVID-19 y la influenza al mismo tiempo. Y como siempre, lávese las manos, cuide su distancia y usa su máscara. Muchísimas gracias para su apoyo. And with that, I will turn it over to Dr. Michael Lin, Infectious Disease Specialist from Rush.
Good afternoon. I want to thank Governor Pritzker for the opportunity to speak today. I'm Mike Lin, Infectious Disease Specialist from Rush University Medical Center. I study how diseases like COVID-19 spread. I've seen firsthand the suffering such diseases can bring, and I take care of patients who have had the misfortune of developing life-threatening COVID-19 illness. I'm also a lucky father of 2 kids, ages 8 and 11, who love to play sports. This topic is deeply personal to me. The governor has asked me to comment about the science behind why high school football and other youth contact sports should be postponed this fall. Here's what the science tells us. COVID-19 is a deadly illness that spreads from person to person through close contact. Contact team sports, such as football and hockey, can become super spreading events very easily. Just one youth athlete showing up with the virus can start a chain reaction of spread that can quickly threaten an entire team. While the virus continues to circulate widely in our communities, there's no practical way to prevent outbreaks from happening in sports, such as football, with all the contact that's inherent in the sport. This is not just theoretical. We've seen COVID-19 outbreaks in college and professional sports teams that have much more prevention resources at their disposal. While contact sport itself provides an easy way on the field for the virus to spread, it is also incredibly important to remember that there are many off-the-field activities that are associated with contact sports, such as athletes using locker rooms, working out in gyms, and traveling together, that provide a perfect storm of conditions to enable the virus to spread quickly. We are all in this fight to halt the spread of the virus, and prevention steps such as postponing contact sports, as hard as it may be seeming on our children, will reduce infections and save lives. With every youth athlete, there is a parent, or maybe a sibling or a grandparent, who may be at risk for terrible outcomes from COVID-19 disease. Youth sports do not operate in a vacuum, and if COVID-19 spreads among our young athletes, it becomes a risk for our entire community. I want to thank Governor Pritzker, Dr. Zike, and Illinois Department of Public Health for following the science and making difficult decisions that will save lives. They need all of our support during this still raging pandemic. But Governor and our public health officials can only do so much themselves. Each of us must play a part in prevention. With prevention, it's hard sometimes to appreciate the results because we never really know exactly whose life we've saved. But the numbers do tell a story, and we have learned that in the past 8 months, that when we as a community are able to follow prevention steps, such as wearing a face mask, washing our hands, and social distancing, the number of COVID-19 infections do come down, and we save lives. These prevention steps can be challenging, and families should find ways to address their children's mental well-being, including getting plenty of time outside, taking walks, and connecting with mental health experts as necessary. I'll close by saying what I told my son, who was really looking forward to playing contact sports this school year. Each of the things that we do to prevent COVID-19 in others, some small like putting on a face mask, others more significant like changing how we play and how we work, is an act of love and sacrifice to our fellow human beings. And this pandemic will not last forever. At some point, with better medical advances, particularly with our hope for effective vaccines, this pandemic will end. But the time to relax is not now, especially as we head into the fall and winter season, with so many lives at risk. Thank you. And now I'll invite Governor Pritzker back up to the podium for questions.
Thank you. You promoted me to doctor for a moment there. Thank you very much, Dr. Lin. I'm happy to take questions from members of the media.
We are hearing, Governor, from so many, including there's been word that your Deputy Governor, Jesse Louise, was going to try to speak to you about this. And with no disrespect to Dr. Lin, I understand his point, but you could also have a different physician come, just like any trial would have an expert who would disagree with him. If these other states, and perhaps Minnesota on Monday, all are saying it's okay to play high school sports, what do they know that you don't know?
Thank you for asking the question. And what I would start out by saying is that you could probably find an expert to take a position any which direction that you want. That is true. But I also would say that Dr. Lin is not alone. Indeed, he is among the vast majority of infectious disease experts, epidemiologists, scientists, et cetera, who are deeply concerned, particularly about contact sports, where there is an exchange of sweat, saliva, other things that are going on the field on a regular basis, not to mention that there's very little protection once they're in the locker room. In the typical locker room, there's not that much social distancing, as you know. There are concerns about that in addition to the field play. There are obviously other sports that have locker rooms, but I'm just suggesting to you that all of the precautions that are being taken by professional sports and by college sports are not available to people who play high school or junior high school sports. And I think the doctors have essentially said, look, we want to get there as fast as we can, but now is not the time, especially as we're entering the flu season, especially as we're entering a season where I think everybody is deeply concerned about a second wave hitting the United States. Dana.
Governor Pritzker, I don't want the facts to get away here, but I'm going to have to tell you the facts, just because I'm a high school coach.
An opinion, I know, is what you're going to offer.
Over
Yeah.
the summer, we had 536 football teams in Illinois had a summer camp in August. That's just 3 weeks. 2 teams out of 536 had a COVID positive, one person, and then in Lake Zurich they had a bunch. 532 girls volleyball teams held summer camps, 0 COVID cases. So, and we followed IHSA rules. We wore masks if somebody touched their face. We'd run out with hand sanitizer. I mean, I don't understand this science and data that you're using. Is it just doctors here, or
Well, I think-
talking to others? Because this is not making sense to a lot of us.
Well, if you-
Kids are losing tens of thousands of dollars on football scholarships, on soccer scholarships, and on volleyball scholarships.
I know, and it's
You know,
it's
but you're on an
devastating.
island on your own. I mean, people
No, I'm
have-
not.
I've lost 12 players that have moved to other states
Yeah.
because of these draconian measures. I mean, I'm sorry I'm emotional about this, but it's to the point where you're hurting our children. And we take risks when we walk outside the door. We take risks every Friday on the football field. And we just want to have a choice.
Yep.
I don't want the government choosing if my son can play football. I'll make that decision.
I understand, and I can appreciate the reaction that you have to it, and I do. And I know that there are many, many parents and kids who would like to be out on the field. And I want them to be out on the field. And as you've seen, sports have been categorized, not by me, by experts about whether they're high risk, medium risk, or low risk. And I'm simply following the science that's been provided. Now, I understand there are other states that have made different decisions. That's one of the tragedies of not having a national strategy here, or being led by a president or a CDC that you could trust, that's providing some direction for everybody. But what I can tell you is that one of the reasons that Illinois has the lowest positivity rate among all of our neighboring states is because we've been very careful, because we've listened to the scientists. We have some of the best scientists and doctors in the entire country, in the state of Illinois. I've been relying upon that, not to mention Dr. Fauci and others. And these are very difficult decisions, and they are emotional decisions even for me. And all I can say to you is that as the information reveals itself, as the scientists come forward with new information, I just want to remind you all that at the very beginning, the CDC said, Well, if you can't wear an N95 mask, don't bother wearing a mask. That was something they said at the very beginning. We obviously have all discovered that science has changed. We have studies now that show that even the cloth mask that you have on now is a benefit to everybody if we would all wear one, or a surgical mask as you're wearing, Craig. So this is evolving, there's no doubt about it, and there have been changes, and there was not an understanding over the summer that when we would allow people to go to sports camps or join their leagues of the summer, there was not an understanding at the beginning of what the transmission might be that occurs. But the fact is that all over the world, youth sports have proven to be very problematic. And that, I think, is why, and I'm not making a political judgment about that, I'm just reading, as I think all of you can, about what other countries, what other states, what other... I understand everybody can make a choice here. There's no doubt about it, and Illinois is making a choice here. We're making a choice based upon the science that there are some sports that are less risky than others, and we're allowing those. Yes, ma'am.
With that, what threshold would need to be met where you would be comfortable allowing high school football this fall? Specifically, do you have a threshold?
You mean a threshold in what way? A positivity rate, or you mean?
Any
Yeah.
other metric that have you said if we hit this positivity rate, if we hit this potential for testing?
That is not what I'm being told by the doctors. There is not a positivity level that they're labeling for me, that at this level, it's safe.
So then
The virus, by the way, even when you get just so you know, no matter what your positivity level is, the virus is still out there. It's just a question of, can you keep yourself safe? Are you wearing the right protective gear? Can you wear the right protective gear? For example, just one more thing, the idea that, bars and restaurants can be just fully loaded at capacity, at their original capacity. I think we've all determined that while this virus is going on, while we don't have an effective treatment or a vaccine, that doing that is literally creating super spreader events. So, that's an example of some things that you just can't, there isn't a positivity level at which you would say, well, that's okay now. It's really about, can we mitigate the effect of the virus by having some kind of vaccine or treatment?
Well, then let me rephrase the question.
Sure.
Is there, since there is no specific threshold that you would then allow high school football to resume, is there, what factors other than, if any, other than a vaccine, or?
If I appreciate your question, and I know where you're going, and I guess I would say I have two doctors behind me. I am listening to them and to literally some of the nation's, most important experts on these topics. So if I may, to help answer your question, because that's where I'm going to find answers, is among the experts, I would like to call Dr. Zike to help answer the question, what are the factors that might lead one to allow a sport to be played in a competitive fashion? So.
Well, and yes, no, I appreciate that, but just so, because I think what I'm looking for is you have a reopening plan, right? And
Yes.
you have, and that has some specific guidelines to allow for certain stages of reopening.
Yes.
So what I am asking is there something regarding specifically high school football, since that's top of mind for so many right now, that would allow, or that would prompt the state to say, okay, let's go ahead and allow it because we've met this, or this?
Right. So again, we are trying to follow also, we do take advantage of the fact that, you learn from what's happening around the world and around other states. And so as we have, you all know, we've taken more strict stances, and that has gotten us to where we are. So as we get lower and lower positivity rates, as we have less community spread, as we learn more about what the effects are in children, we're still dealing with the Miss-C, that side effect, that very serious side effect that happens in children. We are seeing what's happening with, myocarditis, cardiac abnormalities in children who can get the virus. So as we get all of that information, and as we can try to identify ways that we might be able to treat or prevent some of those serious complications, as we see what thresholds for positivity might decrease the risk enough for sports to happen, high-risk sports. We're going to be assembling all of that information, using what's happening in other settings as well, to try to make the most informed decisions. I am working with IHSA. We are trying to see, we all want the same thing. I feel like we don't want to pit anybody against each other. Nobody wants kids to sit on the sidelines. Nobody wants kids to not be in school. Everybody wants the same endpoint, and we're trying to just get there in the safest way possible. And rest assured that we are working to see how we can get there. We want to find a route to get there. We want to do it as safely as possible, minimizing the numbers of lives that will be lost as a result of some of these very consequential decisions.
And if I may say, I'm sorry, Dana, if I may just add that, look, decisions are being made state by state, as you know, and we've seen bad decisions getting made that have led to significant health consequences, right? I mean, we saw what happened in Florida and Texas and Arizona, right, when essentially no mitigation or very few mitigations were put in place, and then you had massive amounts of death. Indeed, they're still going on in the hundreds in some of those states, or collectively in those 3 states. And so we're trying very hard to make decisions that balance the interests of, like we've talked about, for example, health and safety as the number one consideration. A secondary consideration, of course, is our economy. We talk a lot about that, right? I mean, just sort of at the same level as the economy, we're also concerned to make sure that people have in-person education. Putting sports aside just for a moment, we want people to be able to go to school. And so we're working on all of these things because all of us want the same results. It's just that we want to do it with a varying degree, apparently state to state, of how much health risk are you willing to take for the people of your state. I just don't think that this is something that we should allow right now because it's dangerous.
But do you understand the mixed message? Do you understand the mixed message of today with the Big Ten? The president of Northwestern, in fact, just saying moments ago, the medical advice changes, the facts change, and our minds change.
That's true. And as I said earlier, we've learned so much along the way here. But when you're talking about Big Ten and you're talking about professional sports, right? Much different than high school sports. It just is, because of the amount of testing, because of the amount of the doctors that are available, because of the focus on testing for myocarditis. That's something that the Big Ten has said that they will do in kids who contract coronavirus. That's not something that's happening at the high school level. And so we really need to just pay attention here to the different levels. It's not football is the same as football here is the same as football over there. If you could put a bubble around each one of these teams, for example, at high schools, and you could provide the same kinds of services, perhaps high schools could do that. But look, I'm making decisions for an entire state. We have 855 school districts in the state of Illinois, and we have individual schools within those school districts, more than 4,000 total schools. And these decisions they're difficult to make, but it's important that I keep in mind anyway how we can best keep our kids safe and healthy. I'm just going to call on Sarah first, and then I'll call you over your head, and then I'll, yeah.
A little bit. Today, the CDC came out with a playbook for vaccine distribution. It includes 2 doses for everybody, 3 doses for everybody. What do you think of this playbook, and also what is Illinois' plan for vaccine distribution?
So I've been aware that the CDC has worked with 5 states to develop this national plan. I wasn't aware that it would come out today, but it did. I am glad that they have been working with the states on this and that they have come up with a national strategy for vaccine distribution. We, of course, in the state have been working on our own vaccine distribution plan. I have not compared the one that came out this morning with ours, but I would say that it's extraordinarily important to me that we get it to the most vulnerable people first and as quickly as we can, making sure that we're distributing something that is truly safe. Yeah.
Can you just address how much money you think you need from the feds in pandemic relief? I mean, you're putting out these, draconian numbers of cuts and everything.
Yeah.
And how much money do you need, and is it going to be cut for sure?
So I have been talking about this, as you know, since May, the challenges that we would have without help from the federal government. Indeed, the budget that was passed in May by the legislature, they took into account the fact that we would need support. About $5 billion for the deficit that would be developed. That's a projection that would be developed in 2021. There's still more than $1 billion that was part of the shortfall of revenues for 2020. That's fiscal year 2020, March, April, May, June. Of this last fiscal year. And so that's a beginning. I think many people, indeed I, am looking forward, as I look ahead to 2022, the fact that we will still not be out of the economic hole that's been developed here. The coronavirus has just been so terrible for all the states. As I said in my remarks a little earlier, I look at other big states like Florida and Texas, and you'll see the same thing going on in every state. So we're trying very hard to just address the hole that was created by the failure of revenues as a result of COVID-19.
Thank you, everyone.
Thank you.
Thanks for watching, and if you haven't already, please consider subscribing to our channel. And while you're at it, please leave us a comment. Thank you for watching.